Hi, everyone. Today we are going to talk about what obstetric violence is and what are some things that you and your team can do to help prevent that from happening in your birth. Trauma often happens when we're in a space where we feel like things are happening to us and we have no control. Birth trauma is unfortunately very common, and birth is not an inherently traumatic event. And often, what I see is someone kind of going through what I like to call the conveyor belt of care. You may have heard this before, where they're kind of like going along this system of care where there is not a lot of compassion or connection. There isn't a lot of time to really talk about anything other than the very specific medical things that need to happen, testing that needs to happen, and choices around testing and treatment aren't presented. This can lead someone to feel disempowered when they enter their birth journey. The culture of birth today is rooted in a racist and profit-oriented and harmful system of care that grew in popularity in the early 1900s and eventually became the norm in the US. So due to many different issues, like providers not learning how to deliver breech babies in school, not learning how to do specific maneuvers to deliver babies who have a shoulder dystocia, for example, in any other position other than the mom being on her back. In addition to racism and liability and profit, that has all led to create a culture where providers are lacking in skills to support people in exercising their autonomy, where many providers today prefer to tell women and birthing people what to do rather than giving them evidence-based education and supporting them in exercising their autonomy and making their own choices. It's much easier and more profitable to send people in and out through the doors on the conveyor belt of care, where they are much easier to be controlled and they just basically do whatever you tell them to do. So when families aren't educated and they aren't empowered, they are more easier to control. But we've seen that when families don't have access to good quality birth education, I'm talking like something so much better than the hospital birth class. When they don't feel empowered to exercise their own self-agency and choices are made for them, it leads them to having much more negative or even traumatic experiences, and it does impact outcomes. But we are changing this narrative together. And it starts with you choosing right now to show up for your birth, for your education journey, and for your empowerment journey. And this changes the culture for our children's children. So now let's talk about some steps that you can take to prevent obstetric violence in your birth. There are many human rights that protect you in the birth space, and here are just a couple that I think are important for you to know about. You have the right to dignity, privacy, and respect. So that means if a care provider is speaking to you in a way that is harmful or feels violent, if you feel disrespected, you can request a different provider. You have the right to information. So that means if something is presented to you and you don't fully understand it, you can request a second opinion or request more information before a decision is made. You have the right to bodily autonomy and integrity. So what that means is that you can birth in whatever position you want to. You can decline every cervical exam. You don't have to get an IV lock. You don't have to get continuous monitoring. All of these interventions, even down to the simplest and most routine thing in the hospital, like a HEP lock, where they put an IV access port into your arm so that they're able to give you an IV if needed, or a cervical exam, are completely optional. No one can make any medical choices for you or your baby. That is your job. Care providers can make suggestions and they can give you information, but ultimately, at the end of the day, the decision is yours to make. So some examples of obstetric abuse is when a provider is being disrespectful to you and they're treating you in a way that is unkind. Providers could be coercive or use fear-mongering, meaning that they're trying to use fear to scare you into making the decision that they want you to make. Other providers can physically harm people by giving them an episiotomy without their consent or a cervical exam without their consent. And this is especially common during the pushing phase when someone is on their back and they have an epidural and they can't see what's going on. And this is why I recommend that if you have an epidural or you're pushing on your back or on your side, somewhere where your provider has more easy access to your genitals, it's good to have someone on your birth team there at the end of the bed, watching what the provider is doing and vocalizing everything that they see the provider do immediately to help to facilitate a conversation between you and the care provider. if the provider chooses not to tell you what they're doing. Another example, and this one I see can get a little sticky. This is where there is maybe something emergent happening where the care provider believes that doing an episiotomy, for example, is what is needed to get the baby out. But what one provider might find to be emergent, another provider won't find to be emergent. And that can be kind of confusing. But there's a big difference between having a provider do something to your body during an emergent situation and you don't know what they're doing versus a provider saying to you, Samantha, your baby's not doing well. I need to get them out. I recommend doing an episiotomy. Is that okay? And you having an opportunity to exercise self-agency in that moment and be part of the decision-making process is so important to protecting people against trauma. So having conversations with your provider prenatally is really important about what situations can happen during the birth of the baby where the provider would need to be more hands-on or use interventions or life-saving medications, and how that dialogue would go. If your provider is surprised that you're asking this question and they sort of take this stance like they're just going to do what they need to do and they don't seem interested in involving you in that process, it may be a red flag, and it may be worth that you look into a different provider who's willing to have a more cooperative conversation with you and agreement and understanding about how that scenario would happen in a way that also helps you feel safe. Talking to your provider about these things is one of the best steps you can take to protect yourself against experiencing obstetric abuse. Because if you have an opportunity to really get to know your provider and express your wishes for your birth and understand how they operate, what their philosophy is, and if their philosophy aligns with yours, that will give you the information you need to know if you can safely and confidently move forward with this provider or if you need to find someone new. So I invite you to find a care provider who most closely aligns with your philosophy as much as possible and with your values for birth. So you can ask your provider, what is your philosophy? What are your values? Some care providers really believe that birth is unsafe and unnatural until proven otherwise, and they treat all births like a medical event. Also, the values of the staff, the team, and the hospital in general can definitely impact the kind of care that you receive. If the values of the hospital are oriented around profit, that can definitely show in the way that people are being cared for, and you can see that in their outcomes and in the reviews of people's experiences. But a team and facility that really care about providing good, evidence-based care to families, that will shine through and people will have more positive experiences. So looking into reviews can be helpful as well. If your provider's philosophy is so different from yours, and if your provider makes you feel like anxious or uncomfortable in their presence, these are some signs that it may be best to find a different provider if you can. And it's never too late to switch providers. You can look into your hospital's patient bill of rights. Most of the time, you'll find that it is within the hospital's patient bill of rights for you to be able to request a different doctor even when you're in labor. I have seen this happen, and I have seen it prevent obstetric violence and help people have way better experiences, because sometimes when you send that doctor who is not treating you well out of the room, it opens up an opportunity for someone so much better and more aligned with you to come in. Now, this is not your job as the person who is giving birth to send the doctor out of the room, but it is your job to vocalize to your team and to the people who you feel safe with how you're feeling about your care and the people who are around you. If you feel uncomfortable, instead of just kind of shrugging it away and going with the flow, if you can be willing to step into that vulnerability, which I know can be hard sometimes, and share this uncomfortable feeling you're having with your partner or your doula and ask them to help you, that can really help change the course of your birth. So let's talk about some tips for doulas and birth partners. First, it's important to have empathy, to recognize that you're in an environment with other nurses and staff who are probably operating under strict rules. And some of those rules may not be evidence-based. You always have the right to decline anything that is suggested, and you can do that with kindness and with gratitude. For example, a nurse may come in wanting to monitor, and the mom might feel like monitoring is just way too intense in that moment. Sometimes, especially at the end of labor, the monitoring can feel really intense, like just the feeling on your belly. For some people, like anything touching them just feels really intense. And so maybe that mom just needs a couple minutes to get through this contraction or to get off the toilet or whatever she needs to do to feel like she is able to handle feeling the monitor on her belly again. So maybe you want to tell the nurse that the mom needs a couple minutes. But for that nurse, there is probably a charge nurse outside that is waiting for that nurse to come back with the number. And if she doesn't come back with the number, she's going to have to hear about it. So we can stand for our preferences and also recognize that the people who we are working with are also humans, and we can have compassion for them. So you don't have to go into this space as an advocate, like ready to fight, like armed and ready to have like these information wars or these arguments. That's not really what advocacy has to look like at all. It can be so much more simple than that. Really, it could just be a simple no, thank you. Thank you for the information. We understand the risks, and the answer is no. And also stand firm in their preferences and human rights. So let's take the example of a cervical check. What if a doctor came in and said, it's time to check you now? And maybe the mom signals to the doula or the partner, like, ugh, like something with her body language, or even verbally says, no, she doesn't want that right now. I know that you want to check her dilation right now, but she's choosing to decline. You can check back in with us in an hour. Thanks so much for taking care of us. And it's when we say, thank you so much for taking care of us, that we're bringing that compassion and that connection and that empathy to the dialogue. And so we're no longer in this like fight place, like they're going to want to force interventions on us and we're going to have to really guard ourselves. Because the truth is that you and the person who is giving birth are the most powerful people in the room. And if you walk in informed and empowered as a birth advocate because you know the risks and benefits to the options that are available, you're aligned with the preferences of the person who is giving birth. You know physiologic birth and you know their rights. Saying no thank you can become really simple. And you don't owe any justification ever for your answer. If your answer is no, then the answer is no, and that's okay. So, if you're a birth partner and you're wanting to learn more about physiologic birth, learn more about the evidence-based options available, and learn more tools for advocacy, you can click the link below to join the Peaceful Birth Academy, where you can access a community of other parents, weekly coaching with me, and all of my birth and postpartum preparation courses. Remember that this is your birth and your body, and you've got this. Thanks so much for listening, and I hope this helps.